Hi, welcome back to my channel. If you are new here, welcome. My name is Ami. I am a nurse practitioner. On this channel, I make videos about nursing. I talk about mental health. I do hair tutorial videos and I talk about some financial tips. If these are topics that you're interested in, please consider subscribing to this channel and join the family. On today's video, I want to talk to you guys about why you should think about becoming a psychiatric mental health nurse practitioner. And I'm going to talk a little bit about what is a psychiatric mental health nurse practitioner, where can you work, and why is it that you should even really think about this, guys. So again, if you're new here, I am a family nurse practitioner. I have about 6 more weeks left, guys, 6 more weeks before I get my psychiatric mental health nurse practitioner degree. So I am I'm going to be a family nurse practitioner and also a psychiatric mental health nurse practitioner. And I do have videos on this channel about that too, if you want a little bit more information about that. So what is a psychiatric mental health nurse practitioner? So a psychiatric mental health nurse practitioner is an RN or a nurse, a registered nurse who decided to go back to school to further their education, either get a master's degree or a doctorate degree, but specializing in mental health. So for a psychiatric mental health nurse practitioner, you are able to work in outpatient psychiatry, which is what I've been doing for the past 2.5 years. And also you're able to work in inpatient psychiatry. So managing more complex patients that are going through crisis and things like that. So you have the flexibility of working in different areas. You can work in treatment facilities such as rehab and things like that for people that are struggling with substance abuse. So you have a lot of options. So for me, I remember going when I was doing my doctorate degree for my family nurse practitioner program. I remember one of the things that really drew me into mental health was the fact that so going through school and you're working with your preceptor and your preceptor is talking to your patients about, their physical health, because with family practice, you focus a lot more on the physical health of things. You do treat a little bit of the minor mental illnesses like anxiety, depression, panic attacks, but a lot of the time you focus on the individual physical health. So I remember going through that, and there are patients that were really down and depressed, and you're canceling them about their physical health. And for me, it's like there's a reason why your head is on top, okay? So if mentally you're not doing okay, everything else that comes after that, it's pretty much not going to be as important, to be honest with you. You can tell someone that's super depressed all day, you need to exercise, you need to be more social, you need to go out and do things, cooking and things like that. But if they don't feel up to it, or they feel very anxious about leaving their house to go to the grocery store, that really affects their physical health as well. So if you have someone that is depressed and all of a sudden they're feeling better, you are able to go outside, you're able to exercise, you're able to eat more healthy, because mentally you feel like you're doing good. So that was one thing that really drew me into that. And funny enough, when I was doing my family a practice program, my dissertation, of course, has to do with mental illness. So I did my dissertation on focusing on postpartum depression, but this time it was more targeting refugee populations. So I knew that mental health was very important to me, and treating patients wise, that was a main target for me. But the reason why I decided to focus more on mental health is because you are able to own in on one thing, and you're able to specialize and really get to master one thing, and you don't feel as though you're learning all these different things but never really owning and focus on one thing. So for me, what are some of the things that I really love about mental health? Again, it's just, for me, is that specialization. So you get to specialize in just one thing, and you really get to master treating patients' anxiety, depression, bipolar, panic attacks, PTSD. So you really get to own in on things and get to learn a more in-depth knowledge about medications that you're using to treat, non-pharmacological treatment options, and just developing that patient provider relationship. That's very important to me. And it's crazy because I've been working in outpatient psychiatry for about 2.5 years, going on 3 years now. And of course, every job comes with the pros and cons. There are some days where it's really tough, especially when you're managing patients that are really, really sick in terms of mentally, but they're not able to go in an inpatient for different reasons, or some patient that just were discharged from inpatient, they were not able to do a partial program, and you have to see them. There are some patients where I'm seeing them once a week when things are really bad. So you do get those times where it's really tough. With every job, there's always pros and cons. months. But for me, one of the highlights about being a mental health provider is the fact that you see the progress that your patient makes. Like, for example, for me, like a lot of the reasons why for most of my patients, when they feel down or depressed, anxious, a lot of it has to do with their other psychosocial stresses. So whether it's a job issues, whether it's family issues. So being able to really get to know your patient and being able to, sometimes I'm working with not only the mom, I'm also working with the kid, I'm also working with the dad and grandparents and things like that. So you really get to know the family as a whole and being able to actually talk to them on that level where it's not just about medications. I think for me, that's one of the plus things about being a mental health provider. It's like we get to talk about sometimes everything else, and medication piece of it is very small because most of my patients, sometimes they're very stable where you're seeing them once every 3 months, once every month, and things like that. And you really get to talk about family and really seeing them progress. So for example, sometimes I'm seeing patients where panic attacks or anxiety is so bad that it's affecting their personal life, where they're not able to make friends, where they're not able to go to work. So being able to have them do therapy with a therapist and being able to manage the anxiety with medications, and you see them progress, guys, that's just like the highlight for me. I remember I say that a lot, like throughout my work day, because I still work while I'm in school. I work 3 days a week, 8 hours every single of those 3 days. So there are some of my patients where I see them progress and it just makes my day. Like when I see how well they're doing, or we've been trying different medications and things like that, and we're able to finally get things that work, and to see just them light up, to me, that's like the highlight of it. Being a family nurse practitioner, there's definitely a lot of pros and stuff that comes with it. But for me, like I said, there's a reason why your head is on top. So I feel as though when you get a chance to really focus on someone's mental health, everything else tends to fall in line. Whether it's, let's say for example, you have someone that has high blood pressure but they have ongoing stress, or mentally they're not doing okay, or the anxiety is high, that blood pressure is going to remain high because you're not fixing the primary cause, which is if they're blood pressure is high because of stress or because of anxiety. If you're able to help them with the anxiety, not necessarily that you're taking away their anxiety completely, which sometimes you're not able to do that. You're just able to get them to a level where they're able to function with their anxiety, where they're able to still maintain a job, where they're able to still keep their blood pressure low because now the anxiety level is low, their stress level is low. So for me, that's like a major thing. So if you are a nurse and you're thinking about, going to school and becoming a nurse practitioner, you should really strongly look into becoming a mental health nurse practitioner. For me, it's like I get the chance to do both, where I'm able to manage patients' mental health, but also be able to manage their physical health if need be. But if you just want to really just own in on one thing, becoming a psychiatric mental health nurse practitioner may be the route for you. And I hope this video is helpful. And again, for most mental health nurse practitioners, you're almost always going to be able to find a job. The pay is great, and the reward wise, it's extremely worth it, like being able to work with patients and their families and their mental health. And that's pretty much it for this video. I hope this video is helpful. Please comment down below, let me know what is it about this video that you find to be helpful, and consider subscribing to the channel if you haven't already done so. Again, thank you so much for watching. Be kind to one another, and I'll see you on my next video. Bye guys.